So you think when you become a healthcare professional that your biggest task is going to be caring for the patients. But when you work pharmacy, there's so many other things, small things you have to do. You have to manage people. Even if you're not a manager, you're the leader in the pharmacy.
Welcome to Posture and Purpose, where both healing and community come together. Make sure to subscribe on Apple, Spotify, and YouTube. Let's get into this episode with Dr. Michelle Carr Frank.
Hello, and welcome to this episode of Posture and Purpose. Today, I have Miss Ebony Brown, who is a pharmacist here in Lafayette, Louisiana, but she's also a patient of mine, and I can also call her a friend. So I'm very, very happy to have her here today, so thank you for being here.
Thank you for having me.
I always like to know, what is your why behind becoming a pharmacist?
My why has always been to help people. So when I was a little kid, you go through different ideas of what you want to be when you grow up. Of course, your family's going to have an influence.
Sure.
So I was the straight A kid. So they always told me, you need to be a doctor or a nurse or whatever. And, I leaned into that. I thought about becoming a nurse. At one point, I wanted to be a dentist, a podiatrist. And then I realized I'm going to have to go to the ER and do those things. And I didn't want to be too hands-on.
Right, that's not for everyone.
So I said, what could I do that's adjacent to that? I still get to help people. And so that's why I chose pharmacy. I just knew I had to do something that was going to be helping people. So that's how I ended up there.
Did you have a certain mentor or any inspiration, something that really happened that shifted your path?
No. I did not know any pharmacists.
Really?
I did not know. Like I said, I thought about being a dentist. My dentist was willing to let me shadow him. I just had nobody in my life that was a pharmacist. And I just said, hey, let me try this. And thankfully, when I started, my courses in college, it was okay. Like, I didn't just change my mind. I stuck with it. But no, I didn't have anybody. This was just really one of those things I chose and hoped for the best.
Yeah.
And it worked out.
A certain calling and a leap of faith.
Yep, that's what it was.
So when you began practicing, what was the biggest surprise that you've noticed?
So the biggest surprise is what goes on in a pharmacy. I'm just like anybody else. I didn't really work in a pharmacy until pharmacy school. And so I didn't know, what went on behind the counter. I didn't know why things took long sometimes. I didn't know how much multitasking would be required. So you think when you become a healthcare professional that your biggest task is going to be caring for the patients. But when you work pharmacy, there's so many other things, small things you have to do. You have to manage people. Even if you're not a manager, you're the leader in the pharmacy because you're the one on duty. You're the pharmacist on duty. Every prescription that goes through that pharmacy has to go through you. Mm-hmm.
Yes.
So I just didn't realize how much they did. And it's a lot. But, I've gotten used to it now.
And how long have you been a pharmacist? Can you tell us a little bit about your background, where you went to school?
Yeah, so I've been practicing for 9.5 years. I went to UL for 2 years for pre-pharmacy, and then I transferred to ULM, University of Louisiana Monroe. I finished up my prereqs there, and I went to pharmacy school there. And I graduated in 2016, and I've been practicing ever since.
And here you are. Mm-hmm. So what has really changed since you've been practicing?
The clinical part. So that was always changing. Even when I was in school, we knew pharmacists would do a lot more clinical things. So back in the day, it was just dispensing medications, which is still a big part of it. But pharmacists are much more clinical now. So not only do we fill your prescriptions, but we do what's called medication therapy management. We'll reach out to patients, make sure everything's going okay with their meds. We'll review their meds with them. And also there was a big push for vaccinations, right? I guess, a short time before I became a pharmacist, it became very popular. And I would venture to say that pharmacies probably vaccinate more than any other, entity now in America. Pharmacies are huge vaccine hubs, which we saw, especially with the pandemic.
Sure.
Most patients were getting their vaccines at your local retail pharmacies. We were even going to nursing homes and everything like that and doing it. So pharmacy it's almost predominantly non-dispensing now. Part of that is most of that is because dispensing is no longer what makes the money anymore.
Oh, okay. So, yes, that has definitely changed.
Yeah.
Because I think, at least I can remember, we had a friendly neighborhood pharmacist. You went and got your prescription filled there. They knew your name, Again, I'm from a small town. But for the most part, it was a different experience than it is now.
Yep.
Now, it seems like a machine. There's a lot of things going on behind that counter, like you said. What common medication mistakes do you think people make, being that it's just such a hustle and bustle and, such a different experience? Do you think there are mistakes being made by patients or customers?
Yes, to everything. So there's that. The reason we're there is to protect the patient. So our job is to catch the mistakes. The problem with that is we're human, and sometimes it's a very high stress, high fast-paced work environment. But I would say the most common errors I see are duplications of therapy, and that just goes to people seeing different doctors. So sometimes we're getting a blood pressure medication from our primary care, and then we're seeing a cardiologist, so they wrote a blood pressure medication, or same thing for like cholesterol medication. And so when it comes to the pharmacist, a lot of the times, we're the last stop before the patient gets the medication.
Right.
So we're responsible for, first, we'll ask the patient. Sometimes they're very well aware of what's going on. Sometimes they don't. And so we have to reach out to the providers to see what the patient's supposed to be on. So I think that's my biggest one I see, is duplications of therapy. Just because people have to see different providers for different things, and sometimes they just don't communicate yet.
Right, and the patient themselves isn't aware. It's a lot about trust. They told me to take this, so I'm here, give it to me, I'm going to feel better.
Exactly.
Not always the case. You really need to be an advocate for your own health care.
Yes.
And, pharmaceuticals as you should need.
Yes.
So, what about understanding labels? I really wanted to talk to you about this. We always get the sheets that come with prescriptions that detail all either the side effects or how to take the medication. How should every person, is there something simple you could teach us about reading labels and what it means?
Is in regards to just what the medication is or like side effects. There's only a few things you need to really read on that label. And I always tell people, if you're going to read the monograph or the patient information, you never take anything. Because they have to list everything that happened. A lot of times in these studies, for example, I always tell people there's a medication that people take for like a UTI, and it turns your urine brown. But then there's an antibiotic that people also take for a UTI, and it's listed that it'll turn your urine brown too. But if you think about it, most people who have a UTI will be on both. So you can't really say what caused what. You can say you can't really find the causation there all the time.
Yeah.
So I always tell people, read your drug, your strength, what milligram you're on, and your directions. That changes sometimes. It's important to notice if it changes, because sometimes it's not intentional. But that's it. Your drug, your strength, your directions. Is it the same thing you had last time? Has something changed? And don't feel afraid to ask us, because patients have caught their mistakes before anybody else. So
well, and that's good to know. Just be very vigilant as to what you're taking and reading those labels. How important is it to you to tell or to our listeners to tell their pharmacist about other supplements, vitamins, or herbs that they may be taking? How do those interactions play a part, and how would you know if they don't tell you about those interactions? I mean, It's so prevalent today.
Yep.
A lot of people say, okay, well, I'm taking this vitamin or this supplement, or herbs and things like that. How do you avoid that? Is there any system set up to do so?
No, there's no system. We have no way of knowing what a patient is taking outside of the prescriptions we have. Sometimes we can see other prescriptions just because we're getting claim rejections from the insurance, but otherwise we have no idea. And so, you, like you said, you have to advocate for yourself, share the information. We have no way of knowing. And we don't have the time, honestly, to go
Right.
and ask everybody, hey, are you taking this, and this at home? We just don't. So it's always good to say, hey, look, I started this new vitamin, or I got this, I saw as seen on TV, something like that.
It happens.
And sometimes it's things we just don't see all the time, but your pharmacist can always just take your prescriptions, run an interaction check with any supplements, vitamins, anything like that, to make sure everything's okay, because there are lots of herbs and supplements that interact with prescription
Sure. I was going to
meds.
ask you, which one do you have seen, or which one is most prevalent with the contraindications?
We used to see a lot of, is it St. John's wort? It would interact with cholesterol medications, which so many people are on. I don't see too many people taking that anymore. I think maybe it's one of those things where they just, sometimes things just blow up. They become really popular and then they fizzle out. But yeah, anytime you want to know if your drug or your vitamin interacts with your medication, just ask your pharmacist. We can look it up.
Communicate.
That's it.
Communicate. And what are the red flags to you that someone may be taking their medication incorrectly? Do you have people that come and try to refill, especially with, pain medication and things like that?
Yeah.
What have you seen happen with that? Are there any things you can tell us about those experiences?
Yeah. So, I mean, honestly, sometimes being a pharmacist feels like being a bad guy. But we have to remember that at the end of the day, we have to protect you. Sometimes that means protecting you from yourself. Yes. So, like you said, requesting refills. Sometimes, honestly, we're going to, you can expect that if it's a drug that is habit forming or people can misuse, then we'll have those situations where they'll ask to refill it early, consistently. It's not just like I'm going on vacation, but every month it's 4 or 5 days early. So that's one thing, but that's expected. What I get often is patients trying to refill medications early for regular meds, like their blood pressure or something. And so that's a red flag for me, because I'm thinking to myself, why are you on day 30 and you've used 90 pills? So a lot of times the doctor has told them at home to change how they take it. But that doesn't always get sent to the pharmacy to communicate that to us. So they'll tell me I'm out. And I'm thinking you have 45 days left. So the first thing I say is, are you still taking it the way it's written? Are you still doing one a day? Just kind of asking probing questions. And they'll say, oh no, my doctor told me to take 2 because my blood pressure was running high. So I'll say, well,
The doctor didn't tell me that.
nobody told us.
Right.
And it's easy fix. We get a new prescription, but that's the biggest red flag, is the pattern with which they're refilling that medication. Sometimes the insurance is going to block it. Sometimes we get notifications in our system. You just learn there are certain medications that are changed often, or it could be some like medications for neuropathy like gabapentin. The dose is changed often, and we'll have to inquire, hey, did they tell you to take another one? Or because sometimes they do, and we just don't get the communication. There's always a little, there's gaps.
There's
in the
room
system.
for improvement,
Yeah.
right? And what are some of the medication myths that you wish you could clear up right now? What is the one big myth out there?
Well, it's not about a medication. Well, it is a medication, but it's about vaccines.
Oh.
So we still have a very, very big myth that vaccines make you sick, or they give you the virus that we're trying to protect you
Oh,
from.
yes, please. Talk to us in detail about
Yes.
that.
So, for example, we have people who will not get a flu shot because they feel sick every time they get a flu shot. And I always tell people, if for some reason you got your flu shot and then you got the flu, that just means you were going to get the flu anyway. So the important thing to know is that when you get a vaccine, most vaccines take 2 weeks to work, to build up the antibodies, and to build up your immune response.
Immunity, yeah.
And then, so if I get my flu vaccine on Wednesday and I got the flu on Friday, I just was exposed to the flu. And a lot of times people come in to get their shot when they think they're going to be around people who are sick, but it doesn't work like that. You have to do it, with enough time to build up a response.
Right.
So I always tell people the vaccine, most vaccines are inactive, right? And so let's say I'm the flu and I'm wearing this jacket. Your vaccine just has probably like a little piece of the jacket in there. So that every time it sees that gray jacket, it's going to know, okay, that's the flu. I need to rev up,
Right.
So that's all it is. And so it's one of the biggest ways to prevent really serious diseases. And so I just want people to know it's safe. There's data out there. People don't get these diseases anymore. They don't get polio. They don't get smallpox, things like that, because they work. And they're not, now they can make you feel bad. But that means your body's mounting a response to what it's seeing. And so the next time you see it in the real time, in the real world, hopefully it'll have what it needs to fight it. So
it's very controversial. I mean,
it is.
Some people have either had bad experiences, or they've done research, or something may have happened to someone they know. So it's a very personal.
It is.
It really is. It's a very personal decision to make for you and your family, and people basically just need to do their research and make that decision, and how that would play out for the future of your family as well.
Exactly.
So are there any new pharmaceutical therapies or innovations that are on the horizon?
There's lots always. I think the most striking one has been the GLP-1s, so your Ozempic, Trulicity. So they're here, but they're finding that there are so many more benefits to these medications. So they started out as medications to help people lower their blood sugar for diabetes.
Diabetes, right.
Then they realized that they are helping people lose weight. Then they realized they're helping people with cardiovascular events. There's even some research that shows that it helps with habits and breaking habits, or things like that. So I would say watch out for that. These drugs are, they've changed the landscape of pharmacy, really. They've changed the protocols, the guidelines to treating some of these conditions, because they've done so much. We still need to see in the long term how it affects the patient.
That's when we'll know.
And but it does a lot for people. But all of them have side effects and concerns. So it's just interesting to see. We're gonna really be watching those going forward. They're like the big cool kids.
That's all you see on TV. It's all those commercials.
Yeah.
First was Ozempic, and that was the one that treated diabetes. And now there are different tirzepatides and all these different levels, and they each come with their own issues, but they're modifying as we go in a very short period of time. When I say as we go, within a few years, these have changed drastically, and in turn, we're going to see drastic changes in their reactions to different people with their health care. So yes, that's ever-changing. But like you said, from your perspective, you must have seen such a difference.
Yep. We started off with Victoza. Well, it started off with, there's some old ones like Bydureon, Victoza.
Okay, yeah.
Victoza was one that you had to take every day. And so now you have the ones where you just take it once a week. And you have ones that are just, there's even one that's indicated for people with obstructive sleep apnea.
Really?
And so insurances will cover it, because if you lose the weight, the obstructive sleep apnea could be resolved, and you can, I would hope that, because they're very expensive, and they're costing our health system a lot, but it's saving on the other end.
On the long run.
Yeah.
Yeah.
So they're going to be more coming out, and more indications for the ones we do have as the evidence rolls in.
So do you feel at this point it's a positive?
I do. I don't think that everybody uses them appropriately, because there's lots of things that happen when you take these medications. So people have GI symptoms. It slows your gastric emptying. Okay. So that also slows your absorption of certain vitamins and things like that. And so you have to be, replacing that. It also gets rid of lean body mass.
Yes,
so people are losing weight, but they're losing their muscle, the tone,
that's...
and so they should be doing more strength or resistance training. So just like anything, we get excited about something, and then there's still work you have to do for yourself.
There's some drawbacks. Yes,
Yeah. So just like if
you're not off the hook.
Exactly. So there's things that I would love to see. I would love to see patients do to kind of help make this a better experience for them. But
Right. Oh, we'll be hearing about it for a while, I'm sure.
Exactly.
And one question that a lot of people I know have come up in conversation with me. What is the difference between generic and brand name? Of course, we all know it's the price, but how does that differ? Can you explain that to us?
So, okay, when a drug comes out, it's a novel drug, it's going to be brand name only. After a certain amount of years on the market, the FDA will allow other companies to create the same product with active ingredients. The difference is your generics can have different, what we call excipients. So that's like the stuff that just makes the pill. Sometimes it's just lactose, or just the powders. The other things besides the active ingredient can be different, which is why some people can say, I took this generic, I did fine, and I took this generic, and I didn't like it, upset my stomach. So the active ingredient is the same, but the extra stuff can be different. And there's also a percentage of the active ingredient. So I don't remember the numbers exactly, but let's say there may be, the brand name has 100% of the active ingredient. So a generic can have 95% in there. You know what I mean? So for the most people, same thing, does the same thing, won't cause you any issues. Some people are more sensitive, or for drugs that have what we call a smaller therapeutic index, for example, like thyroid medication, the smallest change can affect you.
Oh, yes.
So then, in that case, brand and generic is a big difference. In pharmacy, we're legally obligated to dispense the generic for cost savings unless the doctor or the patient requests the brand, just because of the cost.
Yeah, it's expensive.
And, the data shows they work just fine. Most people will be fine. But there are certain things that differ. And for people, some people are sensitive to those things. So the same, but also understandable if you don't like it. Yes, because it's not,
you can
it's
speak
not
up.
identical. Exactly.
And you can say something. And how do you feel, we pretty much know the answer to this, how medications impact overall wellness, sleep, inflammation, mood, movement? Medications are great, and thank goodness we have them for certain circumstances. But, like I said, you don't get off the hook. You still should get proper sleep. You should still exercise and get great movement. You should still fight against inflammation in different areas. So how do you think medications impact us in that way?
Well, I was just talking to my colleague about this now. Like, I think when people see that we're pharmacists or we're the drug specialists, we think that a drug fixes everything. We don't, which is obvious because I come to you. But there's a place for modern medicine. I always think about, like, when I had my son, I told my doctor, I was like, I'm gonna have him natural and XYZ. And she's like, Ebony, people come up to me and they tell me that, and I'm like, okay. I felt the first contraction. I was like, no, give it to me now. Give me the injection. And so I think back in the day, there was no epidural. People were doing this without pain relief.
Yes.
So there's a place for it, and it's good because we're advancing. But everything does not need medication, particularly because sometimes we don't use them right. Sometimes they cause another issue that needs another medication. And so we have to really start getting to the core of things. At least try non-medication options first, and then be conservative when we are starting medications. But I agree, I see people on 15, 20 medications. I'm thinking to myself, there's such a burden, I'm sure, on them, on their plan. It's just a lot. So finances. I think there's a place for medication, but it's not the only option. And That's just like anything. There should be
Yeah,
options
right.
for no matter what you do.
Right. Explore those options, question the answers, do what you have to do, and advocate for your own health. And what role does lifestyle and posture and physical activity play alongside medications?
Oh, it's the biggest. So many of our major diseases like diabetes, cardiovascular disease,
Yep.
comes from how much we move and the things that we're eating. And so if you think about it, there really wouldn't be a need for a lot of these medications if we had healthier
Put the work in.
lifestyles. Yes. And so, I mean, in America, we don't have the best food. And, studies have shown that, processed food can affect your health significantly. So that's where it all starts.
And we all know that.
We know that.
We just have to
it's not fun to eat healthy all the time, but you have to try. It may not be salads and high fiber all the time, but you try to gradually incorporate that. But it's so important because there are lots of diseases that would not be as prevalent if in general.
Start with a healthy balance and just work your way up to what you would have as ultimately a more healthy lifestyle or eating habits for sure. Are there any medications that commonly cause musculoskeletal symptoms that patients should look out for? Because I do know with some of the patients I see, they come in with a bag of medications. And we have to kind of talk through what the side effects of some of those are. But do you know off the top of your head any?
I would say statin drugs. So statins are your cholesterol medications. You've heard of that, I'm sure.
Yes.
It feels like a Charlie horse, so just a really bad muscle cramps. It's a very common side effect of those drugs. It's really dose related, and it really depends on the patient, but you see it more often because almost everybody is on one for high cholesterol. So that's probably the most common one I could think of.
Okay, and that helps us to know. Hopefully someone listening can learn something from that. And how do you feel like you collaborate with other physicians or practitioners with the patient's overall health? Are you allowed to do so within your scope of practice?
Yeah, so over the years, I've kind of worked through how to approach things. Sometimes when you try to make recommendations, it really depends on the person or the provider. Sometimes they don't really want recommendation, but it's all about how you say things. So when I first started, I didn't really know how to word things. But now I'll call and say, hey, look, this dose feels kind of high. I don't have to wait. Could you share that information with me? Sometimes that's all it is. Sometimes I'm looking at a 4-year-old who's really, a big kid, know, and I don't know that. But it's really just about being respectful. I think that pharmacists in general, we felt like, we don't want to overstep any boundaries, but we practice under our own license. So anything we give to the patient, we're responsible for. And so you have to understand that whatever happens, if the provider gets upset or whatever, and like I said, I don't have that issue much anymore, but you have to realize you're advocating for the patient, and you have to realize that if you don't like their answer, you don't have to fill it, because the first thing is to do no harm. So sometimes you'll just say, and I've done this before, I say, well, look, I'm just not comfortable filling it. And that's the thing, people don't know. You can say no. You want the patient to get their medicine, but not if it's going to harm them. But just being respectful, just kind of laying out your concerns. I've learned over the years, providers really do respect that. Sometimes they're busy. Sometimes they're in the ER. Sometimes they didn't catch it. And everything is electronic now. Sometimes you just click the wrong button. You know what I mean?
We're humans.
So you just call and be human about it and let them know. That was one of my biggest concerns when I first started, but now, I'll call them all the time, and I'll be like, hey, look, I don't even know what this means.
Open communication.
Yeah, exactly.
It's okay not to know, but it's not okay to not question those answers.
Exactly.
Because it's for the better
of the patient.
And their health. What's something doctors often wish patients knew before picking up their prescriptions?
Oh, Lord.
I'm sure you have so many stories that you might not be able to share with us, but that are entertaining. But
I think There's a lot of misunderstanding around about what we do in the pharmacy. So your doctor sends your prescription, and so I don't. I've seen people come to the pharmacy within minutes of leaving the doctor's office, and I'm thinking to myself, I mean, it's not like it comes down a chute here. You know what I mean? We have to process
We're not
it.
at the bank.
And then also the coverage. So we're working in a system where, drugs are expensive. Most people have coverage, but not everything is covered.
Right.
And so your doctor has the best for you. He's got this new drug. He wants to try it out. It's $1,000 and it's not covered. So you get to us and you want your medicine, but unless you want to pay $1,000 for it,
you're the bearer of bad news.
Exactly. So I wish that there was a way that the providers could know, what was covered. And sometimes they pick up on the patterns when we call. And also just to know that I've had like telemed visits, and the provider will tell me, your medicine will be ready by an hour. Now this is the provider, and he's telling me that the medicine will be ready at the pharmacy in an hour. He's no idea. Those people are probably giving vaccines. There's probably a line in the drive-through.
It's
so
not that simple.
I would tell, if I was a provider, I would say, I'm sending a prescription over. Let the pharmacy notify you when it's ready.
Right.
Because we'll get it ready. But just like you were coming from your doctor, we have hundreds of people who are coming from the doctor today.
Everyone wants it here and now.
Mm-hmm. And we can't. We just don't have the capacity to do that.
Right, right. And trying to navigate doing the best work you can efficiently has to be difficult to do that. What about the elderly population? I wanted to touch on that a little bit. How do you guide patients who may feel overwhelmed by that bag of medication, whether it be a complex variety of medications or regimens? How, as a pharmacist, can you help them navigate through that?
We have a few ways to help organize. Most people have pill organizers these days. There are pharmacies that do pill packing.
Okay.
I've never worked there, but they do that. But also, it's very sometimes it gets very simple. Like I'll go to the counter and I'll write cholesterol on the medicine. If they just can't remember, or I'll write morning on it.
That could be so dangerous if they don't. Can you just tell people that are listening what pill packs are? They may not know. I mean, I know because of my caring for my mom, but it was very convenient too at the time. But can you explain what that means?
Yes. So a pill pack is basically when a pharmacy takes all of your medication and then they pack it into a blister. So, for example, they'll blister all your morning meds in this one little pocket, and then in the morning you just pop out everything that's for the morning. So it takes away the organization from the patient. It's already organized. So it's very, very helpful, especially for, like you said, older adults or people with, issues with health literacy or just understanding their medications.
Or mobility.
Yeah, very, very helpful.
Okay, so you see that quite a bit, I'm sure. How do you play a part in awareness and safety of medications? Do you have a say in that at all, being behind the counter, or is that the organization possibly that someone would work for that is responsible for that?
Do you mean if I'm like seeing safety issues?
How do you bring that awareness with safety issues to the patient?
We have an open line of communication with our patients in community pharmacy. That's the most accessible healthcare professional. So people just walk up to you all the time. You just like they walk up to you, you call them on the phone. But we do a lot of counseling. And so there are opportunities before they pick up to let them know about, XYZ. If you take this, or I'll say, hey, look, you're on both of these, don't take them at the same time. You'll be tired, extra sedated. Sometimes your breathing will be slowed. Lots of safety things. So there's things we put in place to counsel them. And we document, of course. But also, like when I went back to medication therapy management, a lot of the insurance companies want you to do these quarterly and yearly check-ins with the patients. And so that's the pharmacist's job to come in and see how they're doing. We check in with them pretty often just to catch any they're taking 2 of the same kinds of meds or stuff like that. So it's really just about constant communication. Sometimes they don't always remember, but right. I'm the kind of person, I'll put the counsel on it every time. you come, just to let you know.
It might be safe
Exactly,
to do so.
Exactly.
Right. So, with that communication, are there any barriers that you see with patient access to necessary medications? I know cost is definitely one, but are there any other barriers that you see in your line of work?
Yeah, besides cost, transportation. So I worked in most recently a population with very limited transportation. A lot of them walked to the pharmacy. So, and then if you get an older adult,
Right.
if they can't drive anymore. So a lot of non-adherence, so just patients not taking their medication right, stems from cost sometimes, but a lot of it is just being able to get to the pharmacy.
Something that simple.
Yep.
We
So
take that for
that's where
granted.
delivery comes in. But sometimes they're just relying on, a family member to come get it, a neighbor or something. And I mean, that's a whole nother situation. You know what I mean?
Right.
That's more socioeconomic, and
Right.
it's just
And it's out of your hands.
Right.
So it must be tough to see and,
it
and
is.
watch.
It is. So then you go to, okay, well, they're having trouble getting to the pharmacy, so that's where you say, okay, let me try to do 90 days. That way, instead of coming every month, you come 4 times a year,
Help 'em
something
out.
like that, or
Right.
fill as many as possible together, so they have
Yes.
to make less trips. You start to trying to think creatively.
Right. And I can't imagine, we keep bringing up communication. What is the either funniest or most surprising question that you've ever been asked while standing behind that pharmacy
Lord.
counter?
Oh my
Is there anything you can share
Let
with
me
us?
think of something. The other day, I get a lot of non-medication questions.
Oh.
I don't know why. I don't know if it's just because I'm accessible, but this man came up to me and he asked me for the Himalayan salt and something else, some kind of oil. And I'm thinking to myself, what? For what? He's like, yeah, it lowers your blood pressure or something. I'm thinking to myself, I'm a pharmacist. Surely I wouldn't know about salt and oils, and that's like seasonings, but I get that all the time.
Yes.
Just, I was told once, you're a pharmacist, right? And I said, yeah. He said, well, don't y'all have a nursing degree too? And I was like, no.
The misconception
No,
of
I
your
don't.
education
Yes.
and your ability under law to give out certain,
Yeah.
advice. I
Yeah.
mean, that's very tricky. I'm sure you've
Yeah.
seen some hurdles. What's the most frustrating part about your job?
The most frustrating part.
And I don't mean hours and getting off for holidays. I mean either legally or when are your hands tied and it's the most frustrating for you?
Yeah, I would say following the laws. So a lot of people don't know that pharmacists, in addition to our clinical training, we had to pass a law exam. So we have to know laws. And so people think sometimes we're just being difficult, but we're literally trying not to do anything illegal.
And
so
harm.
a lot of customers don't know that. Our patients don't know that.
Yeah.
That there are laws to what we do. There are laws to, I may not be able to fill a prescription early every month, and I can if you're, if I see it's fit. But if I fill your prescription early every month, and if you have an unfortunate event or there is something happens to you, then I will be held liable because legally, I didn't do my due diligence to protect you from those early fills. So that's frustrating to me. I think a lot of patients think we just take the orders and do what the doctor says, but there's so many steps between when the doctor sends your prescription and getting it to us, and that's what that's frustrating because sometimes even if you explain it, people don't, when you don't know, it just goes in one ear and out the other, but when you're living it, it's a bigger deal. So that's probably it, just having to navigate the barriers, the insurance coverage, the laws, and the safety, all before we can give you your medication. And not having people understand that. Yeah.
So next time you're at the pharmacy, folks, have some patience.
We'd appreciate it. We'd
and
appreciate it.
possibly a better understanding of how important the time that you're taking behind that counter to make sure that you're providing the best care, and the best way to provide that service to the public is through safety. So
Yep, exactly.
so, with all of this stress and all of these frustrations that sometimes come with your position, how do you stay healthy? How do you stay active? What do you do in your spare time?
I have lots of vices, but first and foremost, I have really strong faith. So I pray all the time. I have no idea how I would have made it this far without constant prayer. So my faith, and then I also have lots of things I do for fun, enjoyment.
Yes.
I mean, we talked about it before. I love growing succulents. I grow plants. That has been so therapeutic for me. So sometimes when you come home from a long day of work, you're running over. Did I do that right? Was the medicine right? You know, you're thinking about things, and then when you get to take care of your plants, you're completely in the moment. You're mindful. So I do a lot of that. And then I like to travel.
Yes.
I like to do my work, and then
We have that in common.
yes, I like to do my work, and then I like to take my PTO.
Yes.
So that's what I do to
Good,
get myself, to keep myself healthy and my mind healthy. I should probably move my body more.
You got to disconnect.
Yes,
you really
you do. You do.
And I find that a lot with gardening also.
Mm-hmm.
The plants aren't in a rush.
No.
They're not going to talk back. They don't want much from you, just some water and sunshine.
Yeah.
And it's just such a nice way to relax
It
and
is.
reset.
It
So
is. It is.
we have so much in common when it comes to all that stuff. I know you know that.
Mm-hmm.
So for our listeners today, what if there was one piece of advice that you would give? What is that one piece of advice, a takeaway from our conversation?
I would like our patients to know, and I'm speaking for all of us, that we are here for you. And despite what it looks like, it may look kind of chaotic, it may be stressful for you. Your pharmacist is trying to take care of you. They are trying to protect you, and they are trying to do right by you. And that's what we got into this for, is to help people, to leave them better than we find them, to advocate for them. And even though there's a lot going on, it seems chaotic, we're still in there building relationships. We are still in there doing things behind the scenes to take care of you that you may never see. And so I would challenge patients to just kind of really look at the person back there when they go, and just imagine all the things they're doing to try to take care of everyone there. Right. And just keep that in mind. Give a little grace, and know that we see you, and we're trying to take care of you, and it's changed a lot. Yes. But at the heart of it, that's still somebody who's there for you.
Yes, in this ever-changing world.
Yes.
And an ever-changing profession.
Mm-hmm.
So thank you so much for being here. But my last question of the day is, how do you maintain your posture while pursuing your purpose in life?
So I maintain my posture by keeping my faith. I have made it 9.5 years as a pharmacist by praying daily and just knowing that the plan for my life is inherently good. Everything that happens to me is also happening for me. And there are things that I've experienced in my career that seem like utter chaos and trauma, but they've really, really changed me for the better. You need that experience in life. And so my posture, I maintain my posture by praying and remembering that no matter what happens, tomorrow the sun will come out. The plan for my life is good. Everything's going to be okay, because everything has been okay. Everything I've ever encountered, every obstacle, I've overcome. Yep. And so if you trust that, then everything will be okay.
Yes.
Yeah.
The sun will come out tomorrow.
Mm-hmm.
Well, thank you so much for being here today.
Thank you for having me.
I've really enjoyed it.
Me too.
And I appreciate you taking the time to do it. So until next time, sit up straight, stay happy, stay healthy, and stay adjusted.
Thanks for listening to the Posture and Purpose podcast with Dr. Michelle Carr Frank. Make sure to subscribe on YouTube, Spotify, and Apple Podcasts. Until next time.